2, 1.
And my foot was just like dangling.
Oh, this you crazy mother.
Yo! Hey, lady!
You don't have OCD.
You forgot your spaghetti!
You have ODCD. Okay, thank you. I didn't know my psychiatrist was on here. I'm actually starving. That should be my middle name. Amberlynn Hungry Reid. I don't know, I just feel so disconnected. She was like, you're healthy, but you are obese.
Hello? Is anyone home?
Hey girls. Okay, so Amber has been dragging her recent health scare along for weeks now, saying it may be cancer or it may just be kidney stones. Amber has said she is ahead on her videos right now, meaning they are pre-recorded, so she already knows the results of her tests and is just clickbaiting at this point. I think this is making a lot of us flashback to when she had her ankle scare, her lung scare, etc., so I thought today we could take a look back at Amber's health scares throughout the years. Buckle up, it's a long one. A lot of these videos we are about to see were major clickbait, with titles like, something is wrong, emergency room visit, I'm scared, major health scare, etc. And I'm sorry if I missed any, I did try my best, but there's way too many to keep up with, lol.
I don't know what I did. I honestly can't tell you. But I pulled my back somehow or twisted my back somehow, and all of a sudden I couldn't stand straight. It feels like I pulled a muscle in my right side, like kind of on the lower side of my back. I'm not that type of person to like go to the ER. I used to be, like I used to go to the ER, oh my god, years ago for the dumbest things in the world. So update on my back. The pain did start 3 days ago, and every day I wake up it does feel better. Almost went to the ER last night because I was like, maybe it's time.
Just because I don't vlog myself peeing doesn't mean I don't do it.
Right.
Hashtag I don't pee a lot in one day, but I'm trying.
They were...
That's why I'm drinking all this. But I don't pee a lot. I pee about 3 to 4 times a day. That's how I know I don't have diabetes. Plus I've been tested.
3 or 4 times a day?
About 3 times. Yesterday was 3 times.
From the moment I wake up to the time I'm going to bed, if I count how many times I pee, I know it's more than 3.
Really?
Hannah and Rafe left a couple hours ago, and I'm actually about to go to the hospital, to the ER, because that pain is still there in my back. Of course, it's nowhere near as bad as it was, but it's like a constant dull ache in my right lower back, kind of where you'd get some kidney pain. So I, for one, am worried, and I want to get that checked out or just see what the hospital says. It is midnight, so I'm going at a time where not a lot of people are usually there. I just know that if something is wrong with my kidneys, I better nip it in the butt now. I just got my blood taken. Traumatizing. My kidneys were just in my brain really bad, and I've never suffered with like a UTI or a bladder infection. So I was scared. I get back pain a lot, and this didn't feel like any back pain I've ever experienced. So I knew something's a little off. I kept telling people like telling people that in my life. So I was definitely freaking out and worried about it. So after they did the test, the doctor came in, and he came in and told me I have a gnarly bladder infection. So this is the first time I've ever had one. Something that I did ask him was, are you sure it's not my kidneys? I know you shouldn't question a doctor, but sometimes you have to, because when I went to the ER years ago, I knew I had gallstones. Like, I just knew it in my heart. And they kept telling me, no you don't, no you don't. And I was like, do the ultrasound and prove it. And I was right, I did, I had gallstones. I hold my pee a lot. It's a very bad habit, and that's one of the ways you can get a bladder infection. I can hold my pee for hours. I have a wisdom tooth that I've been dealing with for almost 10 years now. Like, the pain comes and goes, and there's nothing a dentist can do at this point because I can't go under anesthesia at this weight. I went to the dentist about 2 years ago regarding it, and I was definitely lighter than I am now. Well, I was lighter than I am now. Ugh, grammar. I was in so much pain last night that I was like scream crying. It was horrendous. I had to use several different numbing agents. I took more medicine than I want to admit to. Like, I couldn't open my jaw. Like, it was this whole side of my face, including my ear and my head. It was just a lot. You know, 2 years ago, the dentist told me just find ways to make the pain not so bad, and you're gonna have to lose weight before you can go under anesthesia. And I'm just like, okay. Just feeling pretty miserable from it because it still hurts, but nowhere near as bad as it was last night. And I feel like it's gonna happen again tonight. And I'm just bracing myself pretty much. Hey guys, so it is the next day. I am wearing the same thing I wore yesterday because I woke up and just threw it on because it was right next to the bed. But I am actually about to go to the ER. I just feel like everything's falling apart. Like my whole body is just done, and I don't blame it. But yesterday I started noticing a pain slash a little bit of, I guess you can call it maybe puffiness and hardness near my belly button. And my first instinct is hernia because it also kind of hurt, and I am bigger, so hernia is not gonna be shocking. I was waking up in the middle of the night. I just noticed every time I tried to sit up a little, the pain was a lot worse, and now every time I bend, it's a lot worse. So it really seems like it's a hernia. I don't know. Normally I would just wait to go to my doctor or something, but I just feel like kind of scared because it could be something else. I'm not gonna sit here and diagnose myself, but that's what it sounds like, and I'm pretty terrified. So I'm gonna go to the ER. The doctor I saw was just like so nonchalant about how much pain I'm in and where it's located. They literally sent me home. I was like, okay, if the doctor's so nonchalant about the situation, literally sending me home without a diagnosis, maybe nothing's wrong. So I kind of just was enduring the pain and trying to ignore it. And I woke up today. Not only does it hurt a little bit worse, but now this is like TMI, but hi, Amberlynn is trying to be honest with you guys. My belly button is bleeding. I'm gonna go back to the ER. I am gonna go to a different ER. I feel like if you go to the ER, you should, you know, get the test done to be the deciding factor of what's wrong with you. Like, you should never leave the ER like, oh, you're fine, you're just in pain, in the most weirdest spot ever. Hey guys, so if you watched our last vlog, you know that I went to the ER yesterday. Nothing. I left without a diagnosis or anything, like literally nothing. And I woke up today even worse. And if you didn't watch that last vlog, the last 3 days I've been having belly button, like navel pain, but it's not like inside my stomach. It's the outside. It hurts mainly when I bend. I woke up today and now I'm bleeding out of my belly button. So something is obviously not right. I was going to see my actual doctor, but I kind of can't because it's the weekend. And the ER yesterday said if I get any worse to go back to ER, but I'm not going back to that ER because they just seemed very nonchalant. So I'm going to go to a different one. I'm just really nervous. I just hope nothing's like really wrong. This hospital, ER, way better than the one I went to yesterday. Like, they have been on top of it. You know, the nurse came in, looked at my belly button, then almost immediately after the doctor did, and he cleaned it up. I didn't realize actually how bad it was bleeding until, you know, he was cleaning it, and I was just like, wow. He swabbed it, you know, all that sort of stuff. He came back and he told me it might be an infection. Like, nothing is like for sure. He's like, it might be an infection, and he said it might be something that needs to be surgically fixed. And I was just like, what? She came back with papers about cellulitis, and I was just like, okay, that's weird. And she explained, you know, he's just giving you this just in case this is what it is. And I'm just like I know from experience everything about cellulitis because I've had it twice. I was like literally on the verge of death. It was one of the most scarier times of my life. You know, today's Sunday, tomorrow's Monday. As soon as it's Monday, like literally I am going to call my doctor's office, make an appointment for as early as possible, as soon as possible, and hopefully get this figured out because this is just a lot. Like, it's still very up in the air, and I don't want anything super wrong to be there. Like, I'm scared. As for my eating, I'm pretty much eating whatever I want. So I have some wisdom tooth situation going on. I have a full-fledged toothache. All of these teeth like my whole head, this part of my nose, this part of my tongue, like my jaw up here, my jaw down here, my ear, everything hurts. So I have completely just stopped eating anything sweet. It has been hard. I will 100% say it has been torturous. So this whole tooth situation is almost like a blessing in disguise. Yes, I still have my rash. I have come to very, very high terms here with the fact that I am allergic to the makeup wipes that I bought. So I threw them away. So it's 7:37 and I want to say about 20 minutes ago I just got really cold with shivers, a little bit of nausea. I would say keep me in your thoughts, but this video won't be up. I'm at the hospital. Look how dry my lips are. I'm not really gonna talk about my diagnosis. Let's just say I'm gonna heal with medicine, hopefully. It's not the flu or anything like that, which is kind of bittersweet. I almost wish it was the flu. I feel absolutely miserable. I haven't even changed my clothes, but I'm actually back, or going back to the ER. Something else came up. Like I said, I don't know if I want to talk about it. So, ooh, girl, my breakout, it's getting a little bit better. I will say I'm happy with that, but when it rains, it storms, and now that that's getting a little bit better, like around these parts, other things have to happen. It's actually been a few days since we last talked, and I've been to the ER and all that stuff. And as you guys can see, my allergic reaction is almost gone, besides this beautiful guy over here that I accidentally itched one night. So I know a lot of people were frustrated that I didn't give a diagnosis in my video. And for me, I just felt like there was no reason for it. There are a lot of people who watch me who use my health against me. I wouldn't say I'm ashamed because it's nothing to do with my weight. And a lot of people thought it was a kidney infection. No, it's not a kidney infection, which actually kind of surprised me because I thought I had one. It's something I'm going through and it could very well be deadly. So I have to take care of myself currently. Send all the prayers and just all the good vibes and thoughts. Like, you know, I shouldn't have to say what's wrong with me. My rash is pretty much gone. Got a little update on that. That's doing its thing. So I have been seeing a lot of comments talking about like, why am I on antibiotics still? So I was out in the living room. I was just hanging out with Eric, Ricky, and Becky. At that point in time, I actually sat on a mattress in the floor. We would bring it out there whenever we were out there like hanging out. I don't have to do that anymore because my legs don't bother me like they used to. So it was probably an hour later and I started getting really cold. But when I did go to the ER, because I did end up going, as you guys know, when I did go to the ER, the guy said, I'm very glad that you came here. They took my pee. I did blood testing, swabbed my nose. He came back and he said there was a lot of bacteria in my blood. There was a lot of bacteria in my pee. But what scared me the most is he said there was a lot of white cells. But he said I have a horrible bladder infection. So he prescribed me antibiotics. And I thought, okay, well, I guess that's it. I went home, but then I woke up and went back to the ER. So what happened was my baby toenail hooked on to the mattress and bent backwards, if you will. And I did everything I could to keep it clean. This is like a very common thing because it happened when I was younger, but on my other foot, and it was a completely different toe, but the nail grew back so wonky about a month after that, which was where I'm getting to next. So I went to the ER, had a horrible bladder infection. Okay, simple enough. I woke up the next day and my whole bottom of my leg was super red, like hot. I knew exactly what it was right off the bat. Cellulitis. I was like, I have to go back. The fever, it wasn't because of my bladder infection. That was a coincidence. It was because I had cellulitis and it was growing. So I ended up going back to the ER and I showed them and they said, yeah, you do have cellulitis. So it turns out that when my toenail got yanked off, somehow, I don't know how, because like I said, I took care of it and Becky eventually started helping me more. I got a bacteria in it. And the thing is, cellulitis does not only affect obese people. I know a lot of people think that, which means that you don't have the knowledge of people with cellulitis, like you don't know a lot about it. Yes, a lot of morbidly obese people do get cellulitis, but so do skinny people, like a lot of skinny people. I have my appointment with my doctor today. I'm going to talk to her about my eye because it's been happening for over a month now. When I was like getting ready to go to bed, my whole body like felt like it was buzzing. I have no idea. It honestly scared me so bad. It's just the eye thing is just getting worse and worse, and it's not like a normal eye flutter. My whole eyelid completely just like jerks, and I'm worried about it, especially because it's been over a month. And at first I thought, oh, it's because my sleeping schedule. So I just had my doctor's appointment, and regarding the vitamin D, like she said, supplements too low. So she does want me to come in, do blood work. I'm scared to, because where I have to go to get that done, that town actually has a lot of cases of the virus. And I honestly don't know how to like be careful with that, because I don't have gloves. I don't have a face mask. Obviously, like, wash your hands a lot, but still, like, I could breathe the wrong air. So regarding my eye, she's actually referring me to an eye doctor. So they're supposed to call me. So I feel like she might be a little worried. I don't know. She said that I'm the lowest vitamin D she's ever had. And this whole thing with my eye, I didn't want to talk about it anymore since the last video I filmed regarding it and like freaking out. But it's honestly getting really bad. I have all these random symptoms, and I'm calling another doctor tomorrow. I need answers, honestly. The newest things to add to the list is I'm having these like internal, it just feels like I'm vibrating on the inside. It's very like, you can't see it on the outside, which is what freaks me out the most, I feel like. I don't know why. It's kind of like little tremors, I guess. I don't really know. My eyebrow has officially started joining in on the twitches. My ear, it literally sounds like I'm losing hearing, like it sounds like plugged. My neck has been hurting, my shoulder, my head, like up here, the back of my head. Everything is all the pain and like the stuff is like starts up here, and it's all like right here. I'd love to sit there and just be like, oh, I'm super stressed, that's what's happening. But I think it's the internal vibrations, I'm gonna start crying, is what's honestly scaring me the most. And that's why I said it feels like I'm shaking, but you can't really see it on the outside. And it's like, as I sit here, I feel it. Like I've been having the really bad eye twitch, like a violent eye twitch. That's been going on for almost 2 months now. I'm really hoping to talk to another doctor, because I feel like it's important to get a second opinion, third opinion, fourth opinion if you have to, maybe a fifth opinion. Since I don't have health insurance, I actually pay everything out of pocket, so that kind of sucks, because, you know, the last doctor I saw, all she told me was, I'm gonna refer you to an eye doctor. So I had to pay a big chunk of money just for her to say that to me. Sitting here, my whole body just feels like so weak. Like I don't even want to hold the fork. Lately, every time I eat, my stomach makes really weird noises. I'm falling apart. Isn't that crazy that I'm losing all this weight and it's like now my body wants to fall apart? Couldn't you have waited until I was like 80? That's why I just need to distract myself, honestly, in the best way possible. Keep me in your thoughts, God, and if you pray, pray. I had a little, okay, not really little, a big epiphany, if you will. You know how there's that moment where you realize you need to change? So this is gonna be a eat with me and cry with me. I'm scared. I am too big for a CAT scan. I am too big for an MRI. Like an MRI machine, you have to weigh less than 400 pounds. I'm pretty sure it's the same with CAT scan. God, what did I go to the hospital for? They were thinking about doing a CAT scan on me. He came back and he was like, actually, you can't fit. There's a weight limit. I was so mad and upset with myself, but still, even then, it wasn't even like a pivotal moment. And I think it's because it wasn't that serious. I am scared. Along with my eye convulsing, pulsating. It's not a little twitch, you guys. I am losing hearing in this ear. It feels like my ear's like stuffed or full, but it's like not. And I'm starting to get like little headaches. I'm starting crying. Crying and eating. But it's like, it takes something more big, more powerful to push someone like me to finally truly do something without the lazy ins and the outs and the making excuses. I feel like something really has to happen. For me, it's MRI machines and CAT scans. And what if this house caught on fire? This is not getting monetized. I don't care. I'm just thinking about the reaction channels, you know? Why do you want to react to this? Reacting to someone's downfall. So I got my results back, and I do have cancer. I have womb cancer. So it's uterine cancer. I know it's my fault because I didn't see someone. I knew there's been a problem for so long. Hey guys, so I did just film a grocery haul, which I am going to keep in this video. You guys have already seen it, obviously. I did get a CT. What I had scheduled was an MRI and a CT. I got the CT first, and as you guys know, the only thing that looked off was my lymph nodes were bigger than they should be, which could possibly indicate that my cancer has spread. I do have uterine cancer. So because of the lymph nodes, they wanted me to do a PET scan because that would be able to show if it is cancer. It would light up, my lymph nodes would light up if it was cancer. So I actually was gonna do my MRI and my PET scan in the same day. I actually didn't get to do either of them. I went to the appointment, and turns out the PET scan had a weight limit of 400 pounds. So I am 88 pounds too big. So the MRI was also too big for it. There was not a weight limit. It's more so like a body mass limit. I wasn't able to fit inside of the area that you need to go into. So I didn't get to do either of those. So today I was supposed to be talking about the results from the 2 tests and talk more about treatments. I didn't get results because I couldn't do the test. Oh, update on my cellulitis moment. I took all my antibiotics like I was supposed to. My leg isn't as red. It is still red though, which is really weird. It's not as red and it doesn't hurt or anything like that. It's no longer hot to the touch. So we're good on that. I had the shivers. I was like frozen to the bone and I had a fever. So my brain went directly to... If I would have just waited a little bit longer, we would have noticed that I actually had cellulitis. In the last couple of months, I've gotten cellulitis twice, so that's very weird. I make sure to take care of my body, clean my body. So the fact that I'm getting these infections is very frustrating to me. When I immediately noticed that it was cellulitis, I made a doctor's appointment and I'm on antibiotics. I am feeling a lot better, like I have no fever. The only thing is like when I stand up for too long, I get super nauseous. That's it. Like my leg was highlighter red. It was truly terrifying. And now it's just like slightly pink. So we're doing really good. I love taking the antibiotic. I feel like it's just going through my body, doing what it's supposed to be doing. On Thursday, I ended up actually getting cellulitis. I had a really bad fever, shivers, aches. I was miserable. My leg got highlighter red. It was kind of scary. I got put on antibiotics and stuff like that. So on Saturday, okay, hold on. Last Wednesday, I weighed 491.6. On Saturday, I weighed 482.6. So because of my fever, I lost almost 10 pounds in like 3 days. But then once I started feeling better, I didn't count calories for the rest of the week. I wasn't really watching what I was eating. I was more so just not caring, honestly. I have been in a very bad headspace and I hate making excuses, but I don't know if it's from how I'm supposed to be going through menopause. I don't know if I need help. But I will say without a doubt, I should have lost this weight a lot sooner. I just know that after I got diagnosed with cancer and I had a hysterectomy, my hormones were absolutely insane. Like my body was trying to go through menopause while I was taking a little tiny estrogen pill. Not only that, but my mental health was just like through the roof. Cause I'm over here like, okay, I just got diagnosed with cancer. I literally just had all my female parts just taken out of me. I could no longer have a child. And it wasn't even just that. I constantly was just like, what if my cancer spread? What if I get cancer again? And you think that would scare me into like wanting to change and lose weight and all this stuff, but instead it did the reverse effect. It made me want to numb myself, and that's why I got back to my freaking heaviest weight by like 3 pounds. Should I tell them that
He wants it.
So let's have a story time. This isn't a good angle, but I'm sick. So as you guys know, I have excoriation disorder and I pick my skin. That's why I have all this happening. And sometimes it's worse than others. I've been suffering with like really bad anxiety lately. So I do have some areas on my leg that I do pick and I cannot control it. That's why it's called excoriation. It's so hard to say. Disorder, because you literally can't control it. I'm sure the way you guys are imagining it is probably worse than what it really is because I'm just bad at explaining things. But long story short, I have cellulitis again, and a lot of people are like, why are you getting it so often? It's because of that. And it's easier for people to get it once they've already had it. Hey guys, so this is not entirely something I want to admit, but I have cellulitis again. I didn't want to share it, like, because I fear judgment, but, like, I literally am judged no matter what. This is just what I'm going through. I know a lot of people say it's, like, because of hygiene. It just doesn't work that way. Again, this is going to be another TMI moment, but I do have athlete's feet. I know that's, like, so random, but I have athlete's feet, and that is, like, a major cause of cellulitis. I just know a lot of people like to say that it's because I'm a dirty person. No. Yes, I am suffering with the cellulitis again. I had a fever, I had chills, my leg is just beet red, like highlighter red, nearly like blinds your eyes out. So I'm just back to taking antibiotics, and I'm just frustrated because when it rains, it pours. Am I right? I had an emergency tooth removal. Long story short, it's like so weird. After I had my hysterectomy 2 years ago, I don't know what it was, but I was like obsessed with brushing my teeth. I just remember waking up from my hysterectomy, like having this urgency to like feel a toothbrush on my teeth. It was so weird. For a few months after that, I kind of struggled with brushing my teeth several times a day, like 7 to 10 times a day. And I would just stand there and just be scrubbing my teeth. But I've ruined my teeth by brushing my teeth too much. I don't know what happened, but it made one of my teeth up here crack. And I said, excuse me? I started having this horrible pain. Like, it was like all right here. It was so bad, like I rock back and forth. And then I noticed the tooth next to it was getting discolored, and I was like, cute, okay. Because I've never had like teeth problems. It's not something that I've really dealt with. So I ended up going to emergency dentist because it got so bad that I couldn't function. The pain was so bad. I literally, half of my brain was not working.
It was actually kind of scary. So they did the x-rays and it turns out it's not the tooth that's chipped that was causing the pain. It's the tooth next to it. I had a horrible abscess. They said, we can't save this tooth. It was honestly so traumatizing because like getting a tooth taken out for me is pretty extreme. You know, that tooth has been with me my whole life. When I smile, you kind of see I'm suffering with really bad TMJ. I'm still having horrendous pain. It's especially right here, but it causes my teeth to hurt, causes my head to hurt, causes my ear to hurt. So I have another dentist appointment for that. It's just like, really? So by doing that, I have now caused myself to get these massive headaches up in my forehead. If it's not one thing, it's another. When I tell you it's not one thing, it's another. This doesn't end here. Oh my God, there's like more. There's more. After I had the hysterectomy, they done told me, so you're gonna have to take estradiol every day for the rest of your life. So I said, okay, cool. So when I get a refill, they always do 3 refills, 3 months. So every 3 months I call to get my refill done. And normally it's smooth. This time someone new answered and he was like, we have no information in our system that you take this medicine. And he was like, honestly, my expertise is, I don't know why you're taking this. You shouldn't be taking it. And I was like, what? And he was like, no, people that have had uterine cancer should not be taking this pill. Your office has been having me take this for over 2 years. Now all of a sudden I'm out of the system, ma'am, and I shouldn't be taking it. So he was like, you know what, we're gonna schedule you for an appointment because this is super important. We need to get, you know, you seen, figured out, like, why are you taking this? Because you shouldn't be. And I'm like, I'm just following doctor's orders. So now I'm over here Googling. It's not good. Oh my God. People with uterine cancer shouldn't be taking this pill because it could cause other cancers. So in a few days, I have an appointment. So that's another thing. So I got my dentist scheduled. I got my oncologist appointment scheduled. So we have that down. And I'm just like, what is happening? Today is gonna be my 2nd shot of Ozempic. So I have been on Ozempic for a full week. So my appointment, so I went in, I said, I have an appointment for 8 o'clock with blah, blah, blah. My name is Amber Reid. Your appointment's not in the system. Okay. I had an appointment with my oncologist because I've been taking estradiol for 2 years after having endometrial, which is uterine cancer. And I had a hysterectomy, and after my hysterectomy, they said, you're gonna be taking this for the rest of your life. So I trusted them. I've been getting refills, you guys. It's been 24 months now. And no one has said anything until this month. They said, you should not be taking this. Why are you taking this? So they're like, you need to come in. We need to have like a checkup and see what's going on. Like, who prescribed this to you? Like, everyone was so confused. I wasn't even in their system. I don't even know. So we scheduled an appointment for today, the 21st of July. I go in the 21st of July and they said that I'm still not in the system, that my appointment wasn't scheduled. My oncologist is super popular, super amazing. So I had to see a nurse practitioner. And I was kind of nervous about it because, like, obviously I wanted to see my oncologist because she knows about my history and such. So I saw the nurse practitioner. Oh, by the way, my blood pressure was 111/70. So, healthy queen. The nurse practitioner, when I told her why I was there, she had fear in her eyes. She did. She said, you should not be taking this medicine because it has now increased the chances of you getting cancer again. Yeah, it has now increased the chances of you getting cancer again, and patients with your history should not be taking it. Should I sue them? Malpractice? I'm angry. If I was to have a health problem because of this, I'd be very, very angry, obviously. It has now put me in harm's way. So she's trying to figure out who prescribed me the medicine, which there has been several doctors who have. Looking through my file, they had nothing on me. It was so strange. I feel like, honestly, I'm partially in the twilight zone right now. So she got my blood taken and we did like a cancer marker thing. And I'm good. She said it was perfect, but the number's supposed to be below 40 and mine was 5. And they're scheduling me for a CT scan because it's time that I get another one of those. Because I did explain that I get like pelvic pain sometimes, like if I'm like lifting something super heavy or if I do a lot of bending. I'm officially going through like actual menopause and I'm anxious, I'm worried. I'm just having like a hard time showing it because I think I'm in shock that I've been taking this medicine for 2 years that could possibly have given me cancer, like ma'am. So it was about 3 to 4 days ago. I was just feeling so low. I didn't want to do anything. I didn't even want to, like I was just sitting at my desk. Like that's all I would do all day long is just sit at my desk and watch YouTube. And my girlfriend's like, let's go for a walk. Let's go for a walk. And I didn't want to. I think I was starting to take mobility for granted again. And I wasn't paying attention because I was vlogging. My foot, some of my foot missed the step. I was walking on a sidewalk and half of my foot did not reach the sidewalk. And I ended up falling. The noise, the fucking noise that my ankle made. I don't think I'll ever forget that noise. It was so scary. And like when I sat up from falling, I looked down at the ankle that made that noise and my foot was just like dangling. And it was just so scary. I was like honestly traumatized. When I was walking back into the apartment, I think I was just so shocked by everything. So I was able to limp my way back into the apartment and I was just terrified. So I ended up going to the emergency room. The pain literally just got worse and worse and worse. You know, they did the x-rays, did this and that, and they could not find anything broken, but I have multiple torn ligaments. That's scary for someone my size. The pain just kept getting worse and worse. I was at the emergency room for a few hours and by the time it was time for me to leave, like I could not walk on it. And as someone who's, you know, in the 400s, it's terrifying because it's like anything that I could have used to help myself, like crutches, or they suggested that I use this like scooter thing where you put your knee up. Too big for that too. So I'm having to step on my foot that has several torn ligaments in my ankle. This isn't drama, this isn't tea, this isn't, oh my god, let's react to make some money off of it. Like I literally am actually miserable right now. Pray for me. Like I know I don't like believe in God or like whatever, like I'm agnostic, but in my opinion, when I say pray for me, that's just other people's version of positive thoughts, and I'm willing to accept it all because I definitely need it. Anyways. So I just got out of the hospital. I woke up with really bad pain on my left side in my back. And when I breathe in, it's like this sharp pain and it feels horrible. I called my doctor just to make an appointment, but they said there's no available appointments. And with your symptoms, you need to go to the ER. So I ended up going to the ER. And they're glad that I did. It felt like I was also short of breath, you know, breathing in was hurting really bad. So it's like something could be wrong with my lungs, or they even said that it was like possible heart attack. So they gave me an EKG, as you can still see. I haven't taken any of them off. I also have some on my stomach. And thankfully the EKG was perfect. I also got my blood taken, which I have a whole story with that. They're really glad that I went in because the symptoms are, you know, scary. But since everything looked normal, turns out I just have like a strain, like a really bad back strain, which is so weird to me, so crazy. So I made an appointment with my doctor for next week. I don't know how I strained my back. I guess it could have been because, you know, I hurt my ankle, the ligament thing, and I, you know, laid up in bed for a while, and like how I had to maneuver myself was very different compared to how I usually maneuver myself in bed. On the way to the x-ray room, I was walking through the halls. I was walking and I had my IV, this situation type deal. It's not an IV anymore, and all of a sudden, as I'm walking, I heard something fall and I didn't know what it was. And then I just felt this hot, like weird feeling go down my arms, and I looked and the freaking IV fell out of my arm and I was gushing blood all over me. Oh my god, it was all over the floor. Like 6 different people like that worked there from like 6 different areas just like
came, cleaned up the floor real quickly. I started crying because I was scared. Like, I've never had anything like that happen. It was like blood was just everywhere, all over my arm and hand and all over the floor. Oh my God, it was so traumatizing. Like, it was just traumatizing and gave me a little bit of PTSD because, like, before I got diagnosed with cancer, when I was like rushed to the ER and there was blood like everywhere in the hospital because of me, and it reminded me of that. There was blood everywhere in the hospital because of me again, and it was just like so traumatizing, and I don't know, it was an experience. So okay, so I just got out of the doctor. I was supposed to have my doctor's appointment tomorrow, but it became like kind of an emergency moment. Thankfully I was able to see my doctor today, and I've been crying since the last clip. I got in the car, started crying, and then got home, started crying. There's a lot of things that I'm not sharing, and I don't know if I want to, and I know speculation. I know I said I'm not gonna talk about my fucking ankle anymore, and that was my goal, but it was a big part of my life, and I kept just like saying blah 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 ankle. Like I never went into detail after I said I'm not gonna talk about it anymore. During my whole ankle debacle, all of a sudden, literally out of nowhere, I was having tremendous shoulder pain to the point of I couldn't move my arm. It radiated to my neck. I was feeling it in my back, especially when I would breathe in. I have had a EKG and no heart attack, no heart problems. So I was struggling with that for a little bit, and I thought it was because of how I was getting onto the bed because of my ankle. I thought that I had pulled a muscle. The pain did go away, and that was after I was taking ibuprofen, but then it came back a couple days ago, and I haven't had to get on the bed in any weird way because my ankle is healing. It is almost healed. I feel like it's a little bit more, my foot's a little bit more like this instead of like this. It's a little bit more like this. And actually that happens to a lot of people who heal from torn ligaments. Like when I breathe in, like where your lung is, bro, like in your back, it is this sharp pain. And not only do I feel that, but it feels like my lung is like thumping. Now I have like a little tiny bit of a cough. So I went to the ER, EKG, normal. Blood work, normal. X-ray, normal. So the only reason why I went to the ER is because I called my doctor's office, but there was no appointments. And they literally said, those are your symptoms, go to the ER. You know, as soon as I got to the ER, they did the EKG within 2 minutes of me being there. They said that when you come in with symptoms like that, they need to take it seriously and urgently because it's so scary. So I do not feel bad for going to the ER. So the doctor did fit me in for today. She said she's going to look at my D-dimer, which when I went to the ER, that's what they should have checked, especially because the symptoms that I had. So she was like, I'm going to look and see if they did your D-dimer. If it's normal, then obviously it's not a blood clot. But then if it's a little elevated, then it's something we need to look into. When I went to the ER, they said, oh, that's normal. And in my heart, I felt like they were wrong. So it's like when I feel like something is wrong, I know that I need to be an advocate for myself. After she looked at my stuff and she said they did not do a D-dimer, which I don't know why they wouldn't have, because she even said that. She's like, you know, show signs of possibly having a blood clot in your lungs, so they should have done that, but they didn't. And something actually was found in my x-ray, and for some reason at the hospital, they didn't tell me. Part of my lung, God, I just feel like it's never ending. Part of my lung is collapsed. The bottom of it. And it's like, is that what's causing all this? Like a collapsed lung is kind of a scary thing. She just said the bottom of it is collapsed. She's referring me to the CT place so I can get a CT scan. Like, this is so much. I'm genuinely like scared. So like I was very worried because, you know, I've had uterine cancer, and what if, you know, it was lung cancer? Like, I'm just really scared, you guys. Just please keep me in your thoughts. And if you pray, is because I have my CT scan today. And before my CT scans, I like to spend the whole day kind of just like marinating in the fact that I have to go do this because I hate it so much. It is Friday, so I'm probably not even going to get my CT scans until like next week, which is upsetting because like I need them now. Want them now. I want to know what's wrong with me. I do feel better today. When this first started happening, which was like 3 weeks ago,
it just randomly stopped for like a week and then came back full force with like extra little symptoms. This is for like inflammation of the lungs, in case my lungs are like inflamed. I don't even know. There's this weird sharp pain in the bottom, like where my spine is. But the pain is traveling a little bit, which is scary. I have so many doctor's appointments coming up because I'm like an advocate for myself and actually taking care of myself, and I'm proud of that. I went to my CT scan and I was expecting a different outcome. While I was there, they noticed I was short of breath by walking just like a short distance. And while they did the CT scan, they did automatically notice something wrong with my lungs. So they automatically like called the radiologist. They said that I have fluid on my lungs or around my lungs. The fact that I'm showing symptoms, I should probably go to the ER. So I was admitted to the ER. 5 doctors came in at the same time, and like I just felt like this rush of anxiety come over me because I was just like stuck in the CT circle. Things went downhill for sure. A lot of cancer talk. Since I've had cancer before, to have fluid around or in my lungs could be an indicator that it's cancer. So they wanted me to do another CT scan of my stomach and my abdomen and another one of my lung. They also had me pee in a cup, blah, blah, blah. But then I literally did another CT scan for my stomach, abdomen, and more of my lung the same freaking day within hours apart. I don't know if that's bad, but it happened. A lot of radiation in one day. They found a nodule in my lung. The same lung that has the fluid. It's a lot of cancer talk being thrown around by high professionals. It's very reminiscent to when I found out I had uterine cancer. You know, a lot of people have nodules on their lungs and they don't know. But the thing is, there's usually no symptoms with it. I've had a lot of symptoms, growing symptoms, just the last month. And I've had cancer before. I now have fluid on my lung. A little over a week ago, and they said it was a pulled muscle, to now, since I decided, no, that's not what's wrong. I decided that because I knew something was wrong. And now it's like, by advocating for myself, I am figuring out every single day this is something deeper and something worse, and it's scary. And to think that it's like possible cancer again is not, I'm not knocking doctors, but sometimes they're so busy that they're just ready to move on to the next patient. They said that I need another CT scan of my lung, but this time with more like invasive contrast to be able to like look more at the nodule. I am an agnostic gal, but I want prayers. I need prayers. I'm begging for prayers. I know that might not make sense to a lot of people, but I feel like when your life is on the line and you feel like you're dying, but Amberlynn does a little clickbait called weigh in or bad news or cancer. Why are they allowed to do it and I'm not? It's important to this whole health thing is that I was actually misdiagnosed with a collapsed lung. So they thought that I had a partially collapsed lung, but it turns out that I do not. So I want to let everyone know that that is not a thing. It's a misdiagnosis. They were confused because the x-ray did show something, and that is why I got a CT scan, because they assumed it was a partially collapsed lung. But the 2 CT scans I did have of my lung did show that it was not that it was actually fluid around my lung. It's not in my lung, it's around my lung. It's the nodule that is in my lung. So I have to make that clear because people are still asking about the collapsed lung. They're saying like, so you have collapsed lung, fluid, and nodule? No, I do not have the partial collapsed lung. That is what they first thought it was and what I was diagnosed with. I don't even know what's the better option anymore. It's like ever since I fell, it's kind of like everything is just falling apart. Okay, so I just got out of my doctor's appointment, got the paperwork to go to the radiology and schedule a CT scan of my actual chest, because last time it was just lungs. So it's a whole CT scan of my chest with contrast. My nodule is 1.6 centimeters, if you guys want to know. And once it reached 2 centimeters, that means it's a mass. So that's scary. And I don't know what this is. So it's literally, there's no feeling to it. It's literally, my skin is just red. I don't So I know my videos right now are very medical related. I don't want that to just be what I'm portraying in my life. It is obviously a huge part of what I'm going through right now. Hey, as for like the pain I've been experiencing, it is gone. As for my out of breath that I've been experiencing, that is abnormal to what I'm used to. It has gotten a little bit better. And as for the cough that I was experiencing, that has also gotten better. The pain has disappeared before and it has came back full force with extra symptoms. I'm hoping for the best. I'm keeping my fingers crossed that this was just an infection and the antibiotics that I am currently taking, which I only have 2 left, are actually helping me. I'm just trying to stay as positive as I can because I'm doing everything that I can currently for the situations that I'm in, just continuing to be an advocate for myself. And y'all started noticing, oh my God, why is she just sitting in her videos? Why isn't she vlogging? Why is she like just in her apartment? It's because I had to heal from my ankle. My ankle's pretty much healed, y'all. Like I'm walking, I'm doing my damn thing, but then this whole breathing thing started happening and the pain and the cough. So that's also another reason why I haven't been like out and doing things. You guys hate seeing me in this apartment. Imagine how I feel, especially with my whole ankle debacle. Like, and then like once my ankle started healing, it's like another thing trapped me. I'm just like, really? So just in the last month, I have been misdiagnosed twice. When you are diagnosed with something, that is a diagnosis. If you leave the ER or anything like that with a diagnosis, that is a diagnosis, period. So when I first went to the ER, because my doctor's office told me to go, I left the ER with a pulled muscle diagnosis, period. A few days later, from a doctor, I got a partial collapsed lung diagnosis. A diagnosis was made twice over the same thing, 2 completely different diagnoses that were misdiagnoses. It wasn't a, oh, you might have, or there is a possibility of. No, it was, you have a pulled muscle. It was, you have a partially collapsed lung. I talked to my doctor and I said, I want a CT scan. And so she referred me. She did not bring it up first. I did. I suffer with body dysmorphia in the way of, I feel like I'm smaller than I really am. Like I just look inflated. I look swollen. I just look massive. And that's the first time in years, I'm telling you years, that I felt that way. And it really just like was kind of eye-opening to me. And I was just like, damn, did I finally just notice like, bro, like this is what you truly look like? Or am I noticing my weight gain? Because just before my whole ankle debacle, like I made it to 466, or was it after my ankle? It was around that area. I know it was like a few months ago. I was 466 and now I'm 506. That's a 40-pound gain. It's just everything I've gone through in the last like few months has just been really overwhelming, and it's definitely triggered me into, you know, food habits. And you know, you just had pneumonia. What do you mean you never get sick? I actually got pneumonia from being bedridden. I actually got pneumonia from being bedridden due to me falling and tearing ligaments in my ankle, and I could not walk. So I got pneumonia because of that. And that can happen to anybody. That was actually something I was worried about that was gonna happen. I've never had pneumonia before besides then. So I assumed my symptoms, like if I did get pneumonia, I would know. I'd be like, oh, this would be obvious. You know, I'd have a fever and whatever else it comes with, like what pneumonia comes with. But pneumonia, walking pneumonia, is kind of silent, but it's oh so painful. So, you know, me going to the ER and to the doctor and stuff, like they didn't even know it was pneumonia until they ruled out like a bunch of scary things like blood clot, cancer. They thought some of my lung was collapsed. Like it was a mess, but that is why I got pneumonia, unfortunately, because I fell, was bedridden. My body wasn't used to it. I know a lot of people think that I'm some sort of like lazy lion over here. I'm just in my cocoon all day, every day. It's not like that. So my body was not used to me just like being in bed. Like it was all day, every day. And I got walking pneumonia because of that, all because I fell and hurt my ankles. So the panda sweater, I actually, okay, this is so embarrassing, but you know, it's cool, it's fun, it's fresh. So The last time I got cellulitis, it was summertime, and I was so cold because when I have cellulitis, like, I have a fever. So I put on the panda sweater. I ended up puking, and I got puke on the panda sweater. And obviously we washed it. Hi, that's what you do. You wash things that get dirty. Yeah, I can't live that one down. So embarrassing. You wear your girlfriend's sweater and you get puke all over it. You only see that in rom-coms.
So the reason why I got a new pair of shoes is because I had the same pair of tennis shoes, I want to say for a decade. And then when I fell last summer, tore my ligaments, I got a little bit of PTSD whenever I would look down at the tennis shoes. So I got rid of them. I don't know what it was. I kept blaming the shoes for my fall. It was a mixture of a bunch of things. Right now, I stay confused. I just stay confused because misdiagnosing someone, it does happen. It's a common thing. I just went through the whole lung debacle where we thought it was one thing. The doctors thought it was one thing. Turns out it was something else. Getting misdiagnosed is very common. I had uterine cancer. And I'm sure everyone who watches knows that. And I went to the doctor for the symptoms that I was having. I went to the ER. I always left with the same diagnosis, a UTI. That's a complete misdiagnosis because it was cancer the whole time causing those symptoms. And ever since I had a hysterectomy, I've never had a single one of those symptoms again. It's frustrating that being misdiagnosed is a thing and can happen, but it's also, I swear that's not what these vlogs are gonna be. I just feel like I want to express myself a little bit more, and right now I'm just like, I'm very mad at myself. I exaggerated my food issues because I was in such denial that I exaggerated my food issues when I first started seeing a psychologist. Hey guys, welcome to a new video. So I have not done a story time. It's been a long time. And there is something that happened to me about a month ago that I do want to talk to you guys about. It was something that honestly traumatized me pretty bad. So if you guys remember in one of my last vlogs, I posted this. I have a story time I have to tell you guys actually. Something happened to me. It was about a month ago, and I still haven't wholeheartedly been able to process it myself. It was kind of scary. And I figured, let's talk about it because a lot of people have reached out to me just wondering if I'm okay. Yes, I'm okay. So Feline and I, we were hanging out with some people. It was in the apartment. And I hadn't ate that day. Finally, when I did eat, I chose seafood boil. It has some potatoes. It comes with a normal side of rice. There's some shrimp, crab, sausage. I have a really bad habit of eating really fast, and I don't chew a lot. All of a sudden, it felt like someone literally took my invisible oxygen cord of life and completely cut it off. I was choking on a very big piece of potato that I literally didn't chew. What I went through that day was choking, and Feline saved my life. I couldn't breathe. There was not a single piece of air. It was terrifying. She was trying to get behind me, and I actually all the food ended up spilling all over the floor, like my seafood boil. I literally would have died without her. I lost control of my bowels and I pooped my pants. So obviously I'm a bigger body and I don't know if CPR, Heimlich, whatever it may be, would have worked, but she started beating on my back. That situation actually made me realize me being too big for a Heimlich maneuver, I gotta get smaller. I gotta get healthier. I naturally don't want to chew that much because my teeth do hurt. Like, I've had a lot of teeth issues, especially after my hysterectomy, and like I was obsessed with brushing my teeth for a minute there, but that's like a whole other story. But I have completely messed up my enamel and it was traumatizing. I could not stop crying. But I've been getting actually quite a few messages on Instagram asking if I'm okay and why I had to go to the doctor that one day. Like, normally you would share why, like, why didn't you, this time? I wasn't really sure I wanted to talk about it, but unfortunately I started having that lung issue again. And it turns out I have acute pneumonia, so I had to go pick up antibiotics. So I've been on those for a little bit. I'm actually about to take my last one. And the antibiotics, they are helping. I still feel the issue with my lung a little bit. I'm not sure how I got the acute pneumonia. It is a little frustrating, but they told me last year that once you get it, it's easy to get it again. And just last year was the first time I've ever had pneumonia. So now I'm just, at like a higher risk. I went and saw a doctor, my doctor, who I love, and I got put on antibiotics. I got put on 2 of them. And yeah, I've had to take them for a week. My lung, like, it feels like there's fluid. Honestly, that's the best way to put it. And that's how acute pneumonia feels, supposedly. I trust the doctors. Last time this happened, I got the antibiotics and it was better. So yeah, I just didn't really want to share it because I kind of felt maybe low-key embarrassed, but I mean, it is what it is.
So as you guys remember last year, like, I went through this whole lung thing where I got so many different diagnoses, is that a word? Who knows? These are the ones I got. Cancer was thrown around a lot by professionals. That wasn't a diagnosis, but it was thrown around, so that freaked me out, obviously, because I've had cancer before. Collapsed lung. Then it was an impartial collapsed lung. Blood clot, or several blood clots. Fluid on my lung. Fluid on the outside of my lung. And pneumonia. So all of those things can't be happening at once. I mean, who knows? They could be. But they were all like diagnosed and then undiagnosed multiple times. And I remember taking a set of antibiotics. My lung was better for months. Putting 2 and 2 together, I and my doctor was like, okay, so since your lung got better, like completely better with antibiotics, then I'm gonna go ahead and assume it was pneumonia. So that is what we assumed. But it started happening again a couple months ago. So obviously my doctor assumed again, okay, well, I guess you have pneumonia again. I got put on antibiotics and I noticed that the antibiotics helped a little bit, but it didn't go away. In the last like week or so, I'd say it's starting to get like bad again. And I woke up today and my lung hurt really bad. So I don't want like any advice. I don't want anything like that. I'm just kind of sharing my experience because this is like something pretty hardcore that's going on. But my symptoms are like, I'm a little bit more out of breath than usual. When I breathe in, it hurts, like my lung hurts. It's like a sharp pain, and also it feels like it rattles. Unfortunately, today's Sunday, and I don't want to go to the ER. I don't feel like this is really an emergency because this is something that I've been dealing with for so long. To not know what's wrong with me is very worrisome, obviously. And I don't like it. I don't like the way it feels. Like, you need your lungs. Lungs are important. And it's not something that's like out of sight, out of mind. Because unfortunately, I am constantly breathing. Like every second you take a breath, So I kind of feel like this is like in the same ballpark where I'm sitting here like, am I going to be taken seriously? And when am I going to be taken seriously? It's just hard because there is also a lot of like discriminatory stuff with like morbidly obese people, especially like super morbidly obese people. And so today I woke up in a lot of pain. It started yesterday, like last night. As you guys know, I'm having lung problems. And last year, my lung problem, it also radiated, like the pain radiated to my shoulder. So that is now back again. Plus it's radiating down to like a little bit below my flanks. I'll show you guys what I mean. Like right here. So yeah, the pain is so bad. It's like when I breathe in. It used to be just when I breathe in, but now it's like certain movement. Ugh. So I was actually able to reschedule my appointment because, as you guys know, I called my doctor and my appointment was for like 2 weeks, and I was like, that's too far away. Like, I wouldn't say this is urgent, like go to the freaking ER, but it's definitely, we need to be seen about this. I was able to call to see if like anyone canceled their appointment or whatever it may be, if there was a new opening, and there is. So it's very, very soon. And I'm simply gonna request to see a specialist, a lung specialist, because I feel like we're running out of options. They did so many tests last year and we thought we knew, and like I have no symptoms of pneumonia. This isn't pneumonia. I'm not coughing. I don't have any fevers. Like I don't feel sick. I'm in a lot of pain and it feels really weird to breathe in deep. Eating, and I wanted to give you guys an update on my doctor's appointment. So my doctor was gonna actually give me a diuretic because last year I did have some fluid on the outside of my lung, but she said that since my blood pressure is normal, that the diuretic would actually lower my blood pressure, and she didn't want to put me in a low range. I was like, yeah, I don't think I want that either. But I am referred to a lung specialist. So I am so glad and so happy that my doctor listened to me. I just appreciate this doctor so freaking much. You have no idea. So the next steps are just waiting for the phone call. They're gonna call me to set up an appointment. So I just kind of have to wait around. I don't know if that's gonna be today or in the next few days, but regardless, I'm glad that that step is done. I will say that my pain is definitely still there, but it's not as bad as yesterday. Oh, and I do want to say that I have heard you guys, because a lot of people were asking like about my lung and an update on that. Well, just like last year, where the pain and the shortness of breath and all of the symptoms I had, they kind of like vanished. I'm experiencing the same thing where it vanished. My lung isn't hurting. It's not making that like weird feeling that I was having. I don't know. I'm like really afraid for it to come back, like knock on wood. But a lot of people were asking about that. So I don't know. It's apparent that this comes in waves. I just need to keep that documented and the symptoms that, you know, arise when it happens. And I always make sure to see my doctor when it happens and stuff. So, but for some reason I still have not gotten a call from the lung specialist, which is weird because my doctor literally told me they are calling me. And normally I'm like super impatient, so I end up calling them and I just want to get the ball rolling. But I wanted to take your guys' advice and just wait for them to call me. And since they haven't, I think I'm just gonna call them. But
so I'm on a hair journey. I know in the beginning of this vlog, I said, help me with some heat protectant. And now I'm just saying, no, don't do that. I'm done adding heat to my hair. What has happened has literally traumatized me beyond words. You guys will not notice, and I barely even noticed until I went back and watched like a vlog from like November or December. My hair is fried. I'm losing a lot of hair from down here. My hair is thin. My hair is falling out. It doesn't feel the same. It doesn't. Today I have an appointment to get a CT scan. So I want to explain kind of what's been happening, but I feel like I need to do just a real quick backstory of when I was diagnosed with uterine cancer. So I get asked a lot, like, what was my biggest symptom of that? It was the fact that I bled for over 2 years. I never went to a gyno, because I did go to the ER a couple times. I did see an actual doctor a couple times. And every single time I'd go, they would say, yeah, this isn't normal, but people your size have really weird and irregular periods. And I was diagnosed with a UTI multiple times. I ended up getting a full hysterectomy, so I no longer have a menstrual cycle. So I don't bleed from down yonder. So if I ever notice blood from down yonder, something is wrong. So it was a little over 2 weeks ago, I went pee and I noticed there was blood in my pee. I realized, okay, you know what? This could be just a UTI, but like I was having no other symptoms. Like I had no pain, nothing. So I immediately knew, okay, I need to go to a doctor. Let's get this tested. Let's get put on some antibiotics, get this figured out. So I called around to a couple doctors and one of them was like, we don't have an appointment open until next year. With new patients, it's very different, which I don't understand, like the concept, like there's only certain spots open for like new patients versus like doctors who have seen the same patient over and over. I don't understand. I did go to immediate care. They took my urine sample and I had no bacteria in it. I have no UTI. So I explained to them, I did move to Oklahoma in October. I have not gotten a doctor yet. I did not make that a priority for myself, and I should have. I understand that. So immediate care gave me a card for a doctor that probably would be willing to see me soon. And the only way for them to see if it is cancer is if I get a CT scan, which is what I'm going to do today. Obviously, there's also a chance that it's literally just kidney stones. I have had kidney stones in the past, but normally when I've had kidney stones, I did have pain. I still remember sitting there in immediate care and them coming back and telling me it was not a UTI, because I really believed that it was. And when they told me that it wasn't, again, it was just like flashback after flashback after flashback of everything I went through before I was finally diagnosed with uterine cancer. This happened to you because your weight. This is your weight's fault. This is your weight's fault. Not everything is because of my size and because of my weight. I want to be a person with so many things about them, and one of them just being that I'm super morbidly obese. But instead, I feel like the internet makes me just a super morbidly obese person with nothing else about her. I am only ever seen for my size. Things happen to me not because of my size, but because I'm simply human. But instead of assuming that whatever I'm going through is because of my size, let's like figure out what the issue is first, and then we can figure that out. I'm sorry guys, so welcome to a new vlog. I did just film a sit down video talking about like the reason why I'm getting a CT scan today. That is why I'm wearing the same thing that I was wearing. You guys, I wish I was joking when I tell you this, but the freaking CT scan weight limit was my exact weight, so they didn't want to like have me do it. So they're calling my doctor on Monday and I'm gonna have to do it at a different place, but I just literally cannot believe that. Like I'm so, I get it, it's my fault, but like wow. I really just want to figure out like what's going on, but it's whatever. My mom's taking a cigarette break with her boyfriend. We just ate at a Denny's because there's a salad that she likes here. So it only makes sense that we get a weigh-in and we see my starting weight. I have not weighed myself in a long time, and I know for 1,000% fact I have gained some weight.
500.4 pounds.
500.4. As you guys know, I went to go get a CT scan, and then the limit for the CT scan was my exact weight. They actually ended up calling me today, finally. And my doctor's office simply just told me that they're working on getting me into a urologist and also trying to find a CT scan that actually accommodates my size. So I still do not have an appointment for that. When I had originally told you guys about pee in my blood, I told you guys that I had no other symptoms, like no pain. But since after that, there was a couple times that I felt lower back pain, which was like dull, and then I felt like really sharp pelvis pain. It's very kidney stone coded because that's kind of like what I experienced before when I had a kidney stone. And as of right now, I'm experiencing no pain. I'm experiencing no blood in my pee, but the CT scan is still happening. So that's the update on that. It does make me hopeful that I am no longer experiencing like any of the symptoms, but it is a little confusing still. But I was coming on here to let you guys know that I actually have my CT scan scheduled. So that's gonna be coming up and it's gonna be happening soon. So I'm glad that that's gonna be out of the way because I feel like that's gonna hopefully give us some answers. But I did say in my last video that I no longer have like blood in my pee, at least visible blood. Ever since I started Ozempic, I actually stopped drinking soda. I think I've had one soda. It was like the day I took Ozempic, and since then I've just been drinking water. So my pee looks a little more hydrated and healthy. TMI, I know. Also, I'm not experiencing any more like back pain or pelvis pain or anything like that. So my symptoms are gone. My doctor and I both think that the CT scan is still super important to get done.
489.6 pounds.
What the? So I wanted to give you guys a little update on my health and when my CT scan is. So I told you guys that I stopped having blood in my urine, and then I was having a little pelvis pain and lower back pain, and then that went away. Unfortunately, those things are back today. I have visible blood in my urine, and what I mean by that is there is actually blood that can be in your urine that you can't see to the naked eye, and you have to actually go get it tested, and that's the only way they can see it. So that's why before when I described it as like it's blood that I can visibly see, well that's back. And I've had really bad sharp pelvis pain or groin pain, I guess you could say. It's like right in the middle of like my pelvic area. It's just scary. UTIs, bladder cancer, kidney stones, those three things do share similar symptoms. And I've already been checked for a UTI twice. I don't have it. So it's like, now it's like, okay, Is it just kidney stones or is it something worse? Worst case scenario, like we know what the worst case scenario is, and it's just like, I don't want to go through that again. And this time it would be worse. I was lucky with uterine cancer because uterine cancer is one of the most treatable cancers you can get. And I literally just had a surgery. Like, I'm just doing the best I can. I feel like by the time you guys see this, I probably have my results. So I just needed time to like calm down. Valentine told me to put like a cold rag on my forehead, and honestly, how did you know what your weight was when you went to the CT scan, but the very next day you said you haven't weighed yourself in a long time? So when I went to the CT scan place, they said, what is your weight? And I just said 500. I knew that I was somewhere around there, whether give or take 10 pounds lower or higher. I just knew that that's pretty much where I was. And coincidentally, their limit was 500 pounds. So I was like, oh, wow, okay. So as you guys know, I was supposed to get a CT scan like a week ago, and my weight was the exact weight. So I couldn't get it. So I had to reschedule at a different place. And so that CT scan was literally today. I got a call from them like 10 minutes ago saying, sorry, our computers aren't working, so we're gonna have to reschedule, so you can't come in today. Like, literally, why does this keep happening to me? It's just like, I'm not meant to get this damn CT scan. I understand that like the weight thing is my fault, and then the fact that their computers don't work, that's no one's fault. But it's just like, I feel frustrated because like my symptoms were back yesterday pretty strong, and I just really want to get answers. And I don't want to like head to the ER, even though I was told that if I can't get a CT scan scheduled soon enough to go there. And it's just like, I'm not going to the ER. I'm not going to waste their time. And I'm just keeping my fingers crossed that when they call tomorrow, I can get it scheduled for like literally tomorrow or like the next day after that. But this has been just like literally torture. So I just got home and I'm feeling really emotional. Like, it was a fast process and everyone there was super sweet, but I just felt like after the CT scan, I felt like the radiologist like acted different. I don't know how to explain. She told me that if I don't get a call by Monday to definitely call my doctors and see if they got my results. I don't know, it's just like the way she worded it made it seem urgent, but like that could just be me being like truly scared. I'm just glad the CT scan is over with, and I'm just nervous for like what's actually happening. So I'm actually about to go film a TikTok, so I'm gonna do that.
Anywhere you go, give it on. Anywhere you say, anywhere.
I need people to know that like mental things is scary. Like, there are girls outside right now that are taking selfies in front of a rock wall.